Good afternoon. Okay, if you can share your screen, Doctor.
Yeah, I will try to share it.
Okay.
You have opened the share option to me.
I hope you can do it from your side.
Are you able to see?
Yes.
I'll bring it to full screen.
Full screen is better.
So at the outset, I would like to thank the organizers for inviting me to speak on a topic which is a little unfamiliar for most of you. And being a clinician, and I work with the low socioeconomic groups, so it is very difficult to conduct clinical trials in those groups. So actually, there is a need to present this topic in the era of HPV vaccination, because HPV vaccination, according to everyone, will prevent cervical cancer. But look at this data. In spite of being 15 years old, the HPV vaccine is not available to more than 90% of population in developing countries. And the recent data shows that cervical cancer is very common in India. And also this map particularly is important because it doesn't show the prevalence, but it shows that the countries in blue shades have reduced their cancer incidence because of good screening and because of vaccination and other measures, whereas countries like India and some other countries have increased incidence of cancer, and India has increased incidence of cervical cancer also. Now, these are the risk factors for cervical cancer in women, and all of you are probably aware of this. HPV positive is the most commonly associated, but not always. And all of these are preventable risk factors. And in spite of that, it does occur and continues to kill. There were so many deaths. Now, cervical cancer has a long pre-cancer phase, as you can see over here, up to 13 years. And actually, there should be no excuse not to prevent it. So we'll talk a little bit about prevention. Prevention can be, because the mechanisms of carcinogenesis are reversed by our methods. Primary prevention, of course, is there, and HPV vaccine. I'm not saying that HPV vaccine should not be given, it should be given. But until then, we should not allow women to die. Secondary treatment is once the changes have been initiated and they go through mild, moderate, and severe intraepithelial changes. And during these phases, you can prevent the cancer, actually either by surgical application or by chemo prevention. And I'll be speaking about the chemo prevention part. This is just very briefly, we usually use pap smears, HPV DNA, or colposcopy for diagnosis. And the management of these precancerous conditions, this is a precancerous, this is cancer. So management is either surgical or chemoprophylaxis. Now, why do we need chemoprophylaxis at all? Because the precancer occurs in younger women. It might occur from 25 to 45 years of age, and they might want to have children also later on. So if there are a lot of complications that may be associated with surgery, other options should be studied. I will not go into the details of, but all these complications have been reported, and a recurrence rate of 3 to 7% in long-term studies of including systematic analysis. So while surgery is really the best, because it is a one-time treatment and the woman may not have any recurrence at all. But we have to remember it may or may not. So it doesn't spare the woman of continued screening. Screening has to take place. And it is really the best for women above 40. We need to have options for younger women. So our method is based on non-invasive integrative management of squamous intraepithelial lesions. Here you can see whilst cancer is at the tip, smaller number of cases, there is a large number of women, and really it's not possible to treat all of them surgically, at least in India. And we have a traditional Ayurveda system, traditional Indian system, where actually it is summarized as swasthasya swasthya rakshanam, which means protect the healthy. And second part is aturasya vikara prashamanam, which means treat the diseased. So traditional turmeric extracts and bioactive molecules isolated from it have been shown to have anti-cancer activity in vitro, in vivo, as well as in clinical studies. Treatment of infections alone now, that is a very important part, and that is why we have been insisting on integrative method, not only Ayurvedic, because invariably it is the chronic HPV infection associated with other reproductive tract infections like bacterial vaginitis, chlamydiasis, it could be anything. And in the presence of chronic inflammation, we really don't expect turmeric extracts to act. Secondly, non-invasive methods can be easily repeated and there are no major adverse effects. And this can be implemented by remotely placed physicians also once the screening method and diagnosis are available. However, I will not say that it should not be supervised at all. Some physicians should be in charge. Although endocervical cancers are also known and precancerous conditions can be detected, these are both difficult to detect as well as treat. So mostly it is for low-grade squamous intraepithelial lesions. So what is reverse pharmacology? This is in our center. It's a combination of ancient insights, that is Indian traditional medicine, Ayurveda, and modern discoveries. We have a team where three of us are allopathic MDs with PhD in clinical pharmacological subjects. There are Ayurvedic experts and one Ayurvedic PhD, and all the super specialties are there. And a lot of work. I was earlier at Institute for Research in Reproduction of the Indian Council of Medical Research earlier, but after retirement, I have joined this place, and here already a lot of work was done on turmeric, including work on oral submucous fibrosis, where they showed regression, in the sense the opening of the mouth actually increased. And a study on healthy volunteers was also conducted to show the safety. Actually, I was involved in this safety study also. So earlier I had conducted many studies on gynecologic cytology as well as colposcopy, and shown the association between reproductive tract infections and squamous intraepithelial lesions with cervical cancer, and in various groups. These are IUD users, OC users, condom users, infertility cases, commercial sex workers, antenatal cases also, and various techniques were used. So when I joined this place, I thought it is worthwhile considering the Ayurvedic concepts. All Ayurvedic texts have a chapter on diagnosis and treatment of arbud, that is difficult to cure or incurable growth, rasayanas or anti-aging therapy, and prescribed rutucharya or dinacharya, that is lifestyle. And this is an old saying from scripts, that is Vedas, more than 5,000 years old. And it says that if let us live for 100 years, let us see well, let us think well, and let us hear well. That means a healthy life was really expected. And many traditional Ayurvedic practitioners this is now current literature that I'm showing, that currently also many, and over the centuries, many have treated advanced cancer and side effects of chemotherapy and radiotherapy. There is a list of anti-cancer Ayurvedic plants and their activities. There is a whole lot of literature. And currently there are Ayurvedic and integrative hospitals offering anti-cancer therapy. However, there are no studies on management of precancerous conditions detected by techniques like pap smear or their management. This is just to show that this is a very good description of a painless, causeless, and non-suppurative swelling is likely to be arbud, which is similar to the cancer, and also the use of turmeric for some arbud. And I was particularly thrilled when I read about turmeric oil used in oral cancer, that it might give relief. The concepts of multicentric, recurrence, and metastasis were also there with difficult to treat or incurable cancers. So this is the safety study in which I was involved of turmeric oil. And this was given 3 times a day for 3 months under supervised condition in a clinical pharmacology ward. These are the range of pap smear changes, and we hoped to cause regression in these 2 phases. At least in this phases, we have been able to show regression. So the approach for the first clinical study was that it was very well standardized. That is speciality of our center. We never take unstandardized Ayurvedic products. And we get the Ayurvedic industry to collaborate with us and see that the standardization is proper. Preclinical studies were taken, EC permission. Again, here we use, because the whole world was anyway studying curcumin, we took up turmeric oil in this study. And we repeated a volunteer study for 1 month again, because this was a different formulation and there was no side effects. We also did a usage study in the OPD of Haridra, this turmeric powder. And also we analyzed rather, the data from pap smear analysis, which showed that the low-grade squamous lesions, which were treated with the antimicrobial agents, did not show regression, especially above the age of 40 years. So this clinical study was conducted. 21 participants agreed to participate, but one did not start, one discontinued because of local symptoms. None progressed during 3 months of treatment. 16 had regression and 3 had arrest. That means it remained at LSIL, did not progress to higher grade. And there were no clinical or biochemical side effects. We were also able to show a reduction in serum interleukin 6. These are the levels in normal. Inflammation treated means inflammation in the cervico-vaginal tract. And then LSIL, that is precancer, and treated with turmeric oil. What was even more important was that we were able to, now we are not really adequately funded. We did not have a social worker, but still, because the women who came were convinced that they should come for follow-up, we were able to follow up some women, and we were able to show the persistent beneficial effect at the end of 3 years in some cases. And we were also able to follow up some who did not participate in the study, but were treated with antimicrobials. And half of them showed persistent LSIL. One case of persistent ascus, that means after LSIL, there is a further regression to atypia, and she agreed for a second course, and she had further regression to normalcy without any side effects. There was a significant reduction in nucleocytoplasmic ratio as studied by micrometry. So the approach for the second study was that we would have liked to reduce the duration of treatment. And there were a number of curcumin formulations which were available. Now even a vaginal cream is available, but our preference is for oral extract. Apart from the convenience for the woman herself, there may be immune modulation in favor of protection against cancer. Secondly, we also saw that the reproductive tract infection was well accepted by the couple, not only the woman, but her husband also. And that is why we thought that for this study, we would like to add curcumin, because more bioavailable curcumin lipid particles were used in this formulation. And we also added, so we made it more holistic, basically, whereas the previous one was just more of turmeron. So here the inclusion exclusion criteria are given. These were the same as in the previous study. And here you can see the regression that was seen in colposcopy as well as in the pap smears. Even the micrometry also showed a reduction in the nucleocytoplasmic ratio. And in this study, we had added bleeding time and clotting time, because there are a few reports of altered coagulability, particularly when vaginal formulation is used. Now, we need to remember that vaginal formulation may actually be more bioavailable and may cause more side effects. Whereas with the oral, we have not been able to observe a change in the bleeding or clotting time. But however, I agree entirely that the numbers are small. Then we wanted to do one more feasibility study without any added research staff, so long as the formulation was available without any research fellow. However, we had to abandon this because of the COVID pandemic. Now, there have been other investigators who have realized this potential to prevent cervical cancer because of its long precancerous phase, but none of them is really in use, because either because of the partial efficacy and also because of severe side effects, intolerable really, which may be there with these. Actually, the recent review just talks of surgery and vaccine in the preventive measures. But surgery at the right time, just removal of that much portion, is really good, I would still say. We showed that turmeric oil was effective and safe, that holistic extract was more effective and safe. And that is why now, this time we proposed, because there were a few cases of local irritation. In Ayurveda, they have prescribed medicines which might have a cooling effect and which might reduce the side effects of turmeric extract. So we intend to use local Ayurvedic medicated oil, which can counteract the side effects, so that more women, here also, although women discontinued after 1 month, they still showed the beneficial effect, and there was no recurrence at 6 months we had followed up. So we believe that non-invasive integrative methods are a valid option. These are my colleagues who have participated in most of these clinical trials. I am thankful to them, and also thanks to all our women participants and their spouses who agreed to participate. Thank you very much for the patient listening.
Many thanks, Dr. Jayashree, for your presentation.